Thank you all so much for sitting with us all day. Thank you to that really fabulous panel. Very sobering information for us all to process again. Also some elements of hope and inspiration that like we've had all day long. I did want to, by the way, hi, I'm Susie Baldwin, Dr. Baldwin. I'm the medical director of the Office of Women's Health at LA County Public Health. I use she, her pronouns. And again, thank you all so much for being here today and sharing your expertise with us and being here to learn so we can better care for survivors throughout our systems. I did want to follow up on something Amanda said about survivor advocates. One of the things that we advocate for is increased funding to help survivors identify and go through professional development opportunities so that those who want to can be part of our movements to create better systems for other survivors. And our Office of Women's Health had the opportunity to evaluate a survivor advocate bedside program for people who have experienced human trafficking. And this was through the Common Spirit Health System, which you may know as Dignity Health. And we found that the program was very promising in terms of its ability to improve hospital personnel's ability to provide trauma-informed service delivery and to connect survivors of violence with resources. And the program was focused on human trafficking survivors. Most of the people that the nurses and doctors and social workers and staff identified were survivors of sex trafficking. But they did also, just by thinking about the impact of violence on people's health, find survivors who are experiencing intimate partner violence, other forms of sexual violence, and not much labor trafficking, but all of these forms of violence can actually benefit from advocates in the healthcare setting. And this model, as you all know, is much more familiar in the sexual violence space, where rape crisis centers do provide a bedside advocate to help a survivor get through that process, going through an invasive exam, going through the process of being interviewed. But really, the skills that many of you in this room have of helping survivors feel more comfortable and empowered and that they're in a safe space where they can be as honest as they need to be to get the help they need, we're missing that in our healthcare systems. So I just want to put that idea out there that bedside survivor advocates in general are great, survivors and advocates even have a more special ability to connect with people going through these forms of violence. And I'd love as a movement for us to further elevate that model and expand it, at least in our county. So before we go into our closing session, does anybody have other comments or questions from anything today that you'd like to bring up? Anything you'd like to share? Any concerns? All right, if not, we'll go ahead and introduce our closing speaker. So I'm very honored to present to you Dr. Priya Batra. Dr. Batra joined the LA County Department of Public Health in 2022 and serves as the Deputy Director of the department's Health Promotion Bureau, and that's where both the Domestic Violence Council is located, Office of Women's Health, and the Office of Violence Prevention, as well as many other great public health programs. Prior to joining the Department of Public Health, Dr. Batra worked for several years in Medi-Cal managed care leadership for the Inland Empire Health Plan. She has a background in health services research and is an adjunct physician policy researcher with the RAND Corporation. Dr. Batra is an obstetrician gynecologist, and she still sees patients. You can find her in clinic on Wednesday nights in South LA at the MLK Outpatient Center county site. She brings a strong commitment to health equity and community engagement to all of her work. She completed her undergraduate degree at Brown and medical school at the Columbia University College of Physicians and Surgeons. She did her residency at UCLA, where she also attained a master's degree in health policy and management from the Fielding School of Public Health. It's been truly a pleasure for us in the Office of Women's Health to work with her since she became our bureau director, and I'm very happy to introduce her to you. Welcome, Priya.
So I'm really honored to be invited here today, representing the Los Angeles County Department of Public Health, to join you in closing out this incredible event, which addresses a really significant public health issue that impacts the safety and well-being of so many members of our communities. So first, a huge thank you to the Leadership Council for Domestic Violence in Healthcare, who worked with units in our department, many of you sponsors, to arrange this event. So I've been introduced. As was mentioned, I am Deputy Director of the Health Promotion Bureau. And we're really fortunate, I think, in our county to address the issue of domestic violence as a public health issue from a public health perspective in a way that's centered on the experiences of survivors. I'm also an obstetrician gynecologist, and it's been really inspiring today to see so many of you share challenges, but also local solutions to the complex impacts of intimate partner violence. I know it takes a lot of courage and fortitude, especially of survivors, like many of those we heard from today, and the tireless efforts of many other allies in this room to begin to break cycles and chart new pathways forward toward healing. So in thinking about how to close out today's event, I reflected on how I feel when I attend really important meetings like today's. And so I imagine some of you may have similar feelings. So first, there's some degree of overwhelm after being confronted with like a lot of new information, a lot of business cards, a lot of connections. And then along with that, there's like a buzzing excitement about, okay, can I implement these new ideas? Like, what can we do better? Because it's Los Angeles, there's the will I beat traffic thought, right? But I think most critically, as was mentioned by our last panel, there's usually also this sense of like hope and optimism and energy to really get something done, right? Even when we're faced with a serious challenge like domestic violence. And so I hope that I leave you with that hope and that this belief that this is something we can really meaningfully address together. And so to reflect, we had an impressive lineup today, and I want to sort of tie all of that together. So first, we started with healthcare leaders from around our region who are really addressing how their systems break barriers that survivors face to accessing quality care, and really focusing on delivering trauma-informed services and creating systems that meet the needs of survivors instead of the reverse, right? Survivors do not have to come to meet us where we are. We had a profound plenary session from Paula Walters on strangulation and domestic violence trauma that was really moving and highlighted those invisible injuries that survivors face. And so we know that long after physical healing is complete, there's really a lot of additional navigation that has to happen in terms of the health and social consequences on that individual, on their family, on their network. And then this afternoon, we really started to talk about some models that break down barriers to access to care by optimizing care in the context of pregnancy, mental health. And we learned how to optimize benefits that are available through Medi-Cal to meet the unique needs of survivors of domestic violence. And I really want to call out the advocates in this room who never forget to bring that population to the table, who has special needs when we're talking about the Medi-Cal program and other public benefit programs. And then finally, I think really critically, we heard on the survivor experience from survivors of what it's like to navigate care. And so it's very hard to hear that our system has far to go, but it's also really wonderful to hear ideas about how our systems can serve survivors in a way that honors the intersecting identities, sees the whole person. And so I think we have a lot of system leaders in this room, you know, and I feel obligated to reimagine our processes, like we're in control of this to really make integration happen. And then finally, we had our afternoon plenary where we heard from some leaders in domestic violence about how closely our work is intertwined with federal and local policy. Like everyone here, we talk about VOCA a lot. We heard about it today, but we also pushed on it successfully, I would say, to some degree here at the state. And so really, I think that we have to keep pushing for policy that really recognizes that this infrastructure and services that VOCA supports and other similar funding sources is essential, right? It's a safety issue. And so in this spirit, again, as we heard previously, I wanted to acknowledge this intersectionality. And so I wanted to highlight 2 communities where additional focus, I think, is needed, as was already recognized today, in terms of addressing violence and healthcare needs. First, we need to continue marching towards expanding protections for LGBTQ+ survivors and building systems that inclusively serve transgender, gender nonconforming, and intersex survivors. It's already been mentioned that we have data, right, that supports that compared to cisgender individuals, transgender individuals are about 2 times more likely to experience interpartner violence and 2.5 times more likely to experience sexual violence by an intimate partner. Also want to uplift that 1/3 of our county's population is composed of immigrants. And while more than half of those immigrants here are naturalized citizens, many, especially people who lack appropriate documentation, face seemingly insurmountable barriers to getting help, even after experiencing violent crime. And then again, intersectionality, those challenges are compounded when you're also a member of another group, someone with limited English proficiency, someone who has other intersecting identities. And so we really need to, again, uplift these communities, because when we do better in marginalized populations, we all do better. Don't worry, there's not that many more pages. So as I listened today personally, I was making connections to my patients and my experiences, and so maybe you all made some of these connections to your clients and your experiences. And so again, as a physician, I know how important it is to consider and think about safety when I see pregnant patients for care. It's a period of heightened risk. We know that our patients who are pregnant and postpartum are at higher risk of emotional, physical, sexual violence, and so I know that I'm taking care of these survivors pretty much every day. We know it's associated with adverse infant health outcomes, right? Many studies from around the world have showed that violence from a partner during pregnancy is linked to low birth weight and preterm birth. Those are leading causes of infant morbidity and mortality in this country. Similarly, a pregnant person themselves is at increased risk of complications, miscarriage, mental health issues, postpartum depression, substance use disorder, and it can also be deadly. So more pregnancy-related deaths are due to homicide than all the obstetric complications. We have quality improvement and hospital activities around hemorrhage, hypertension, sepsis, right? So we really need to be cognizant of that. That's how I think about it in my practice. But then I would say that my provider colleagues and we also have opportunities to think about how this system can do better, right? So I really challenge us all, and this is for providers in healthcare, this is for service providers, to think about how can we redesign systems and processes to better serve survivors. So there are many features, I would say, of the healthcare system that we've come to accept as static, but I would argue that they're really mutable in ways to be more trauma-informed and to be welcoming to survivors. So could we think about ways, as clinicians, for example, that our settings could support continuity of care and relationship building between me and my patients? In my experience, intimate partner violence generally isn't disclosed or addressed at the first visit or in a one-off visit. So how does this system support continuity in relationships, and how does it not? How could the duration of your visit and the timing of your hours be more flexible to accommodate survivors? How is your setting welcoming when children accompany survivors to a visit? What could be implemented in your setting? Could there be childcare available? What could you do to be open to that? And then finally, we've heard from some of our speakers about co-locating services to address the navigation challenges we've heard a lot about today. How could that be implemented in a care setting like yours? And we focus a lot on navigators, I think. That's like very of the moment. I would argue that our systems should not need to be navigated, right? So what are we doing to change structures? The work of advocating for survivors and ensuring that the voices of survivors are elevated doesn't exist in a vacuum. So we're called today to move beyond silos, healthcare, advocates, social service providers, shelters, government, and understand that our work is interconnected. So only when we consciously and diligently work together, not just in these meetings, right, but between the meetings, can we break down silos and build these better systems. So look around. take in the solidarity, feel a little optimism, and I hope to leave you with that energy to continue to push our work forward. So thank you. Can I pass it to anybody else?
It's me.
All right. Thank you.
Santa on the last day of September. Okay, how's everybody feeling? Tired? I am, I'm not gonna lie. So, we are about to wind down our day. And first of all, I would like to thank the foundation, Futures Without Violence, our speakers, our staff, vendors, exhibitors, and all of your support for Beyond Silos. I would like the Symposium Planning Committee to please stand. So we start planning this in May of every year for you guys. This dedicated group of people, and we start with the brainstorming of what we feel the topic that should be addressed, and we take it from there, and then the magic happens, and voila, we're here. But since we all work for respective agencies and have 22 other million jobs, it's really nice that we pull together to make this work for you guys. So we again appreciate you. We know that you're busy, and we just want to thank you out loud and be seen for all of the work that you do. So thank you. So our exhibitors today, the National Health Resource Center on Domestic Violence, a project of Futures Without Violence, the Los Angeles County Commission for Women, Violence Against Women and Girls Committee, the California Black Health Project, Anti-Violence Ventures, and the Central Neighborhood Health Foundation, and the West Adams Lamert Park Family Source Center. We would like to thank you for being our exhibitors today.
We want to thank our sponsors, the Blue Shield of California Foundation and the National Health Resource Center on Domestic Violence.